Hi, I'm Dr. Jim Duddle with the San Diego Be There program, and I want to discuss a simple, evidence-based approach that has prevented thousands of heart attacks and strokes in people with diabetes or high blood pressure or who are at high risk for heart disease. You might already know that people with those diseases are 2 to 4 times more likely to have a heart attack or stroke than those without it. But did you also know that over 60% of them die of one of those events? And many of those deaths can be prevented. But the scientific evidence on the most effective way of preventing them may surprise you. For people with diabetes, we used to focus on achieving near normal sugar control, but new results from a trial show that this approach does not work at preventing deaths. In fact, it slightly increased them. Evidence shows that what is most important in preventing those deaths is taking a cholesterol pill called a statin and an ACE pill such as lisinopril. And even better, if the blood pressure is high, we combine that lisinopril with a blood pressure pill called a thiazide for double protection. You may be wondering, aren't most patients with diabetes, heart disease, or high blood pressure already using these? The answer is no. More than half are not treated. Why is this? Well, one reason both patients and practitioners might agree on is that starting and maintaining these pills is just too complicated. Imagine the steps. First, you need to measure the cholesterol and blood pressure, then repeat it at another visit, then start the medicine, then another test, then another visit to titrate if needed, then repeat that over and over till the goal is reached. It's just too many hurdles. All of that could be pretty discouraging, but let me share with you how we implemented a simplified approach. We launched an ALL initiative to start 3 fixed-dose pills at once. The A stands for aspirin, the L for the lipid-lowering pill, the statin, and L for lisinopril. But if the blood pressure is high, we now combine it with the thiazide and call it TALL, or TAL. These drugs protect against all 3 artery changes needed to produce a heart attack or stroke. First, the cholesterol plaque growth is slowed by the lipid-lowering statin. Next, the chance of a crack in the plaque may be reduced by the lisinopril and, if needed, the thiazide. But even if it does crack, the aspirin blocks the clot that suddenly causes the attack. Not surprisingly, we found that after 3 years in 70,000 patients with existing heart disease, high blood pressure, or diabetes over 55, who took both lisinopril and lipid-lowering pills, reduced their heart attacks and strokes by more than 60%. Better yet, the healthcare system actually saved money through decreased hospitalizations, and it even dropped the patient's costs by using generic pills that cost less than 25 cents a day. Finally, we have shared this 3-pill approach with more than 80,000 patients at the Safety Net clinics. Keep in mind, although the bundle is simple, taking it daily isn't, but it's the key thing to do. Here are some steps to start a program that you can take now. First, engage and get commitment from your clinic leadership, providers, and healthcare team, including coaches, front desk staff, nurses, and pharmacists. Next, identify at-risk patients using tools like a diabetic or high blood pressure registry and the new American Heart Association Cardiovascular Disease Risk Calculator. Then empower, engage, and educate patients to take their pills. Finally, document outcomes, and change your plan until you hit your goals. Yes, it's a lot of work, but let me ask you, if your patient was a relative or friend, wouldn't you want them to be offered this pill bundle that evidence shows might save their life? And last, to start all and tall. If not you, who? And if not now, when? And thank you for your time. This program was created and made available by Kaiser Permanente's Community Benefit and a grant from the United States Department of Health and Human Services.